Good evening. We begin tonight with COVID in schools. CityNews has dug into the data and found 1 in 3 Toronto public schools have an active case of COVID-19. The numbers for Toronto's Catholic schools are higher, while in Brampton, almost half the schools have active COVID cases. Both Toronto and Peel are in lockdown, so it's no surprise they have more cases than the provincial average. But when we told the Premier about these numbers, he acknowledged it's concerning.
Yeah, it definitely sets off alarm bells, Cynthia.
Here is the data. In the Toronto public system, there are 206 schools with active cases of at least one student or staff member. That's 35% of TDSB schools. And there are 79 Toronto Catholic schools with an active case, or 40%. The numbers are even more concerning in Brampton, where 48% of all schools, public and Catholic, have active cases. The government has consistently said it's safer for students to be in school and that its priority is to keep them open. It has never mentioned that cases in lockdown regions are significantly higher than the provincial average, which is 14.6%. 4 are currently closed due to outbreaks. The education minister stood in the legislature yesterday and insisted schools were safe.
But parents want the facts, and here's a fact that I think would instill a level of confidence if they knew that 99.95% of students
Member
are
for Davenport, come to.
Has your government been downplaying the situation in schools?
I'd never downplay anything, Cynthia. Anything I know, I tell the people the next day. Numbers don't lie, they're out there.
The chief medical officer of health has said several times it's important to keep schools open for children's mental health. And students and staff are bringing COVID into the schools, but that it is not being spread inside them.
If the circumstances change and there's a huge increase in the number of cases at schools, we might have to take another look at it.
Today, the Premier announced the government has started deploying rapid testing in long-term care homes in rural communities. He called it a game changer and suggested if schools needed testing, that can happen. Well, I spoke with epidemiologist Colin Furness. Now, he does not believe schools need to be closed, but he says they should be tested regularly.
We should be doing surveillance testing broadly in the province. We should have been doing that since April. And by surveillance testing, I mean you don't test people because they show up at hospital looking sick. That's diagnostic testing. Surveillance testing is you go and test people because they're at risk. So before we closed bars and restaurants in Toronto, we could have and should have tested waiters. That would have given us the evidence that we needed to act on that sooner. We should be testing teachers, because they are also in high-risk positions. And if you want to know what's going on with COVID in schools, test teachers. But Ontario has been very resolutely committed to not doing surveillance testing. We are not trying to control transmission with testing. We're controlling transmission with lockdowns. I think this is unfortunate.